Hi guys, Dr. Nick here. So today I just wanted to explain a little bit more about kind of FSM. As you can see, I have everything around me, and just like how to use it so that like if you ever had your own machine, how to optimally use it. But just because sometimes people get confused or they're unsure if it's actually working. So I have the models of Inspiristar. So I'm just going to go through some of that in terms of the accessories that I also have with it and how to utilize them for optimal use. Okay, so I'm just going to go through the simple model of the LCD model of Inspiristar. So this one I would consider for home use for patients because we can pre-program different protocols that are specific to the patient, and they can take it home, or if they want to purchase it themselves. Just because it does have a screen, and that makes it so much more easier for you to understand what you're actually inputting in terms of your therapy, in terms of the protocol. But usually what we have with these types of machines, we have our special gloves that will conduct, so that we'll put in wet towels in order to put on a person. We'll show that a little bit later. We have our push pin leads, so those can go into kind of our sticky pads, our adhesive pads to put on the body. And then also you can purchase, if needed, alligator clips. So you can wet towels and clip them onto those in order to be able to do therapy. So that's the basics of some of the accessories. And then we'll go into how to physically use the actual unit and how to look, or how to actually wrap the gloves in towels in order to use them on the body. Alright guys, so now you see we have some towels and we have the gloves here. So I'm just going to go through, like, example, if I had a patient, how I would set up their physical kind of treatment in terms of the getting the towels ready with the gloves in order to be conductive, in order to help do the therapy. So again, you wet the towels, you wring them out, so you don't want to keep them too wet. You want to use kind of a lukewarm, warm water, but not too hot for a patient. And then at the same time, sometimes what I like to do is actually I wet the gloves on top of wetting towel, just to make sure that they are a little bit wet so they can conduct effectively and efficiently. So example, this bigger towel, this would be an example of what I would use maybe on the neck. So I put the glove in the middle with the wire hanging to the side, and then I would roll that up or fold it up so you have it more kind of tube-like, and then I would be able to wrap that around somebody's neck, as you can see, kind of like that. Then I still have my cord to the side where I would actually hook onto the machine to make it easier. Say then I wanted to kind of work on then the belly as an example. So this is a smaller towel. Of course, you can use different sizes depending on what you're utilizing it for. But again, wet towel, I'd wring it out. That's lukewarm water to warm water. Sometimes, like I said, I'd wet the glove a little bit just to make sure that it's conductive. And then for this one, simply you can fold it again. You can fold even just in half if you needed to, because this, maybe I would put this on the belly of a smaller person or even child in a sense. And then we would connect, of course, both of these wires. So this side, the red, was the positive lead, and this side is the negative lead, and we'd hook it up to our machine here, where we have positive for the red, and then negative for the blue. And then depending if we're doing anything specific, where we have an alternating current or a polarized current, then it really does depend where we put both our leads. But for simplistic sense, in a simplistic sense, we're just going to say this is over our neck, this is over our abdomen. Now we can run a protocol, say example for the vagus nerve. So that's how we use kind of the towels. And sometimes just with this, so you can realize, sometimes you'll see that it's not connecting with the machine. And that means that this area here, those lights would turn on. If they turn on, one of those leads is not connecting to the machine. So that could mean that maybe the gloves aren't wet in order for them to connect with the person and actually connect back to the machine. So the first thing I would do is kind of wet the gloves or wet towels if they got too dry, in order to see if there's a connection again. The connection would then be that none of these lights would turn on. If it turns on, it's a red flag saying something's not connected, the lead's not active. So the whole point is to go and check that out. But that's the simplest thing you'll probably come into in terms of when you're trying to start it up. So now, another way to kind of connect to a patient without physical towels is actually using the push pin connections. So here in the newer models of the machine, so this is the LCD model, the push pins in the past, there were 4 separate ones, 2 for the negative and 2 for the positive, as you can see here. But now with this newer model, the newer kind of connections, you can actually connect both, say, positive terminals together to create kind of one glove, and both, of course, negative terminals together to create the second glove. And then with these, you can actually input them into the gel pads or the adhesive pads, sticky pads. So again, and then just like you would gloves, putting them on your body, you can stick these anywhere is specific towards the therapy. So if you had shoulder pain, you can put one on the shoulder and one maybe towards the elbow if it's going down your arm, or same kind of idea. If you're working on the belly, you can put one in the front of the belly and one on the lower back in order to work, say, example, on the small intestine. So that makes it much more easier instead of having to use 4 whole pads and trying to make sure that they crisscross properly so you're getting the proper connection. So with these, what I do, just to the side, because you can reuse them for the same person, of course, is that I wet the area of the body part, or you can wet it yourself, and then stick them on just to make sure that they're stinking well, so that you can physically get a connection, and then the machine's telling you that there is a connection by not having the red lights turn on. That means that when the lights are not turned on up here, that there's a connection happening. The last thing you can do here too is then, in terms of connecting to a person, is you can use these alligator clips. So this would be simple. You would hook them on to kind of here with the push pin pads. Once you have them hooked on, then you can kind of just, if you want to use a towel or something of that nature, clip them onto the towel. That's how simple it is. So you would do that you would have 2 kind of separate towels to be able to hook them on, to put them on 2 different areas of the body that you're trying to work on, or a specific area, and you're trying to work on it in a more specific sense. So that's the basics of just some of the physical accessories and how to use them or how to kind of apply them. So hopefully that is a little bit more understandable, but then I'll now show you how we can actually use the physical machine or the device in order to kind of optimize treatment. So this is the Inspiristar, kind of the LCD model, which has which is programmable. It's not manual, we can't manually input frequencies, but it's good enough for a patient in order if they had to take it home, rent it from their practitioner, or even buy their own unit. I'd advise to buy these ones versus the ones that don't have a physical screen, just so that you have a better understanding of what you actually are applying to your body when you're given protocols. So very simply, you can see off button, on button, pause button, protocol list button. You can, in terms of the input, you can increase the current to make it a little bit more intense. You have a backlight button in order to open the LCD screen to see the backlight so it shines better. And then, of course, your cursor is kind of going up and down. So let's open it up. So there's a start menu. We can press stop there. Then we have protocols available here. That's turning off again, second time, but going back there. We can go to protocols. If we press back here, it says all protocols, recent protocols, history protocols, batch protocols, settings, and about. I just like to go to about sometimes so that you can understand too. If you go there, option number 6, you can see what version you have, of course, but more important for the home user, battery status. So backlight there, so now you can see, it tells you how much battery you have left in order so you can understand if you're going to be able to run it through a protocol. So let's go back now and let's go to protocols. So now in this machine, you can hold up to 99 protocols overall. So that's a lot for an average user if you're using it at home yourself. But in general, it's very simple to use. All you got to do is, like, if your practitioner has kind of programmed the machine for you, then you'll know the different protocols that are available for you. They'll give you a list. Once they give you that list, you'll be able to go through it. So example, let's say we want to work on, let's go emotional relax. So all we do is press start on that. So now you can see here, there's 2 red lights going on, right? So like we said in the previously, that if these red lights are on, that means nothing is connected to the person. So if we had then the gloves kind of already locked in here and they were connected to a person, then that backlight, these lights here would not go on. But that's just kind of for troubleshooting to understand that if there's a connection or not. And then of course, if the lights are on, like it says, when we're doing that, then you must check the connection to make sure that the person is connected, so that in order for the frequencies to be able to go in the body. So we pause that. So you can pause it during it. You can also, when you're utilizing, let's put the backlight on again, you can actually increase we said the intensity, which is the current. So you can see right here, it's 100 microamps. So you can increase that as needed. And as you increase, you don't need to increase it at all. I think keep it whatever your practitioner told you to do, or your doctor, because that's probably the best for you, because it's not wise for everybody to increase that. But if needed, you can decrease it too if it's too much in terms of the output on you. So then we have, of course, the amount of time the protocol has been running for, the amount of time the specific frequency pairs have been running for. So in this protocol, there's 21 pairs. It's telling you the countdown of how much time is left for that one pair, which is on channel 1, 94, and channel 2, 200. So that's pretty simple overall. And then, of course, we're going through it very simply, go down. There'll be a lot of different protocols. And that's kind of it. There's nothing too special about that. You can press the edit button if you needed to when you go back to the main kind of menu of all protocols. And then you can press the edit button to be able to skip a little bit quicker if you have a lot of protocols in there. So going 10. So that just makes it easier to go towards the protocol if it's like 99 out of 100 or out of the 99 protocols. So that's what it is. And then when you're done, you press stop, stop again, turn it off, the end. Guys, thanks again for watching. I hope this was informative. You actually learned something from it, just because I want people to understand how to use their home units if they have them at home, so they can be successful in terms of troubleshooting and just applying them properly and more effectively as needed. So continue to follow me so you can learn more about what we do here at Arini Healing Solutions.